Social value is a way of increasing the outcomes from public sector spend in a way that leverages greater benefits for the population than we might have otherwise got.
There are a couple of ways I think that the NHS can support the development of social value. One, like in the North West, is to create a social value foundation, and the aim of that will be to be an advocate to promote social value and potentially to grant aid real local developments that could help stimulate new thinking.
Salford Royal is one of the largest employers in Salford. By working with the community and with other partners, we're able to provide some benefit to people that are out of work or the children that are at local schools and need a future.
We recently had a doctor came into the school who was a former pupil of St Patrick's as well, which was absolutely fantastic in terms of raising aspirations for our current pupils. And she delivered a session as part of the curriculum that requires the pupils to understand about peak flow and blood pressure. They also discussed different ways in which your blood pressure can affect your health, different illnesses that might affect your blood pressure and your peak flow, and linked that in with a healthy lifestyle as well. So, you know, things like drinking and smoking and healthy eating, and again linking what they do in the classroom to the real worlds of work, so it gives them some meaning to why they're learning what they are learning in the classroom.
I've never worked in a hospital before. I've always done warehouse work, construction, stuff like that, and I fancied a change. Working here with patients, knowing that they know who you are and stuff when they didn't have a clue before, and they walk in and they have a big smile on the face and stuff, it just makes you go home feeling a lot better. I've really not gone home stressed one day. I've gone home with a smile on my face, feeling a lot better, and I'm more confident as well.
So we started the volunteer learning scheme about 5 years ago because we wanted to reflect our local community and tried to bring people into employment who perhaps hadn't got the opportunities in other circumstances.
I come from a very deprived area. If it wasn't for the project, then I would have had no chance because people don't look at you in the same way. But through this project, I think everything's just worked out brilliant.
In my previous job, and I only worked the day for 2.5 days, I had a bad experience through my disability, for my hearing problem, telephone, and that's when I lost my confidence, and that's when I went through the job centre, and they advised me to go to work experience with NHS.
I came here and did some volunteering work. My mum thought since I got this job, she's noticed that I've got a bit more confident, you know, when I'm more confident around the place. It makes me happy because I get to meet quite a lot of nice people.
My health and well-being is a lot better now. I don't feel depressed, and I just hope that it makes my life, well, it has made my life better, and it's also made my son's.
A lifestyle coordinator role is about sort of enthusing staff, motivating them and supporting them in delivering a health promoting service, if you like, to patients while they're in hospital. I think in raising the issue with patients around lifestyle behavioural change, some staff themselves have recognised that they feel as though if they've got a problem themselves, they find it difficult to talk to patients around some sort of lifestyle behavioural change. We have had quite a few members of staff who have referred themselves to the service in the same way that we refer patients.
At the end of the day, I don't want to ask patients to start thinking about losing weight when I've got a weight issue myself. I actually signed up for it myself, and so I go to college. I go on a 12-week course and learn all about different aspects of weight management. It boosts your self-confidence and everything. It's dead social as well. It's really social, and we have a laugh about the daft things we've done to try and lose weight. I'm actually in the same situation as the patient is at the moment. You know, I could be looking at heart disease, diabetes, you know, ruined knees, all because of my weight.
What we do is we bring them into Pathways. We offer them paid work experience for 6 months They operate a project within the community. In this instance, we're looking at worklessness within the community and the impact it has on people's health.
And it was 6 months' work for us to just get back into things and used to it and have employment, bring a wage in.
If you like helping people, then this most definitely would be a call sign for you to do something with your life. For other people, it's just a way to get back into work routine.
We're discussing the barriers to work, out what we can do to try and help different classes of people to get a job.
It's been good for everybody's self-esteem. Everyone's got to know new people and get out instead of being stuck in a normal rut at home, applying for jobs, not really getting anywhere.
We were good enough at one point, and now being told looking for jobs and that weren't good enough. The self-esteem's just gone so low, but now it's like a little bit of hope. So everyone's just like, oh yay, we've got something.
I'm going to go self-employed, but it's just been like a stopgap to build onto something else and give me confidence to be able to build up and do things. They can tell me what paths I can take to succeed in the future.
The Wishing Well project started 7 years ago as a result of some research that was done into the disadvantaged areas of Crewe. We got the contract to run the community cafe, the IT information point and the advice service. That's as well as other activities we carried on running in the community, in schools and community centres, working on community health and initiatives. The project is community led, so we're actually running services that the community are asking for.
I love dancing. I lost my partner, so Wishing Well filled the hole.
Well, it's very good socially. You meet lots of friends and we just think it's good exercise. And they do a luncheon club here as well, and they get bingo and there's a computer group. There's lots of things you can do.
This is a family learning day. It's part of Family Learning Week, and Wishing Well have managed to get some funding to organise activities for parents and children to engage in, and an opportunity for children to have a bit of interaction with each other as well.
Merseycare is a specialist mental health and learning disabilities NHS trust. We provide a range of support services to people from in their own homes, in the community, in community settings, outreach to wherever people are, all the way through to giving people safety and support at times of acute distress.
I was an inpatient when I first started, and I was feeling really isolated and really depressed, and the music gave me a way to communicate with, connect with people.
Well, I come into Garrick sessions because my friends here, Phil, who comes in, and we start singing together, and it just lifts your mood, you know what I mean? It's just all right.
I love music, and I just think it's fantastic to be able to play with other people. At the moment I'm struggling really because I've got like 1 or 2 things I've got to sort out. I've got to get somewhere to live, so it's taken my mind off all that hassle, and it's really cheered me up.
The initiative is about giving football opportunities to adults post-16 with mental health problems. This programme is run by the Everton Foundation, which is a charitable organisation connected to the club. The people who use the facilities are people who are accessing mental health services on Merseyside. Most of the people are referred into this programme through Merseycare, the NHS Trust, and third sector organisations like the Richmond Fellowship, Imagine and the Five Boroughs Partnership.
It gets me out the house, it gets me fit, it gets me socialising, and I like the banter with the lads and the girls, like, you know, it's good all round, like.
If I wasn't playing football, I'd be hanging around with my mates, but it just gets me off the street and stuff like that, like with my mates.
When you're actually playing, and you can feel your fitness getting up a bit, because some of the tablets that you get put on from the doctor, it puts weight, you know, it helps you put weight on, and really, that, you know, you really need something like this to get an activity to get it off, like.
I
counsel students just as a part of the job. And I've transferred that then to working with people within the community.
We do different dance moves, do some swing, do some salsa, and anything that keeps us up and jumping really.
I've been coming every week, every few lessons, and it makes you feel relaxed and happy.
I've had some really bad days the last few days when particularly I didn't even want to get out of bed, and yet I managed to get up and get going this morning, and because I knew this group was on this afternoon. It's particularly good for me because I've got really bad anxiety, so it actually takes, because it's vigorous, it takes your mind off the anxiety quite well.
I like going back to the ward and if I've done something, achieved something.
This could be a group that you could be attending outside of hospital, so it's a bit more like real life as well, which is good.
Over the last year we've had some really good conversations with some key people within the NHS and within the Department of Health around how social value becomes really embedded in the health system. You know, if we can turn those conversations into practical examples, it's going to be fantastic.
Benefits accrue to all citizens in the community, from the disadvantaged to the disabled to the wider public. It's about how we can work together as organisations, as institutions, for furthering development in the community.
I think it's all about connecting with our populations, and it couldn't connect better into the new government's hopes around big society. It seems to me that the health service, like all public services, has really got to engage with its population. So is social value part of the future? I think it probably is the future.